Thank you, Dr. Tripathi, for sharing all the digital technologies that are happening in public health. And now we're going to turn over to panel one. I'd like to introduce Holly Howard, who is the lead for California Connected. And she and her panel will be talking about CA Notify as part of California's ever-evolving response to the pandemic. Take it away, Holly.
Fabulous. Thank you so much. Good morning, everyone. I have the pleasure of introducing our first panel and panelists, two of California's public health heavyweights, Drs. George Rutherford and Erica Pan, who will continue to help us set the stage for our symposium today by providing an overview of the COVID pandemic and public health response in California. Dr. Rutherford, professor of epidemiology, preventive medicine, and pediatrics at UC San Francisco, is going to talk first about the current state of the COVID-19 pandemic in California and dig into some of its current and ongoing challenges, followed by Dr. Pan, California State Epidemiologist and Deputy Director for the California Department of Public Health Center for Infectious Diseases and UCSF Clinical Professor for Pediatric Infectious Diseases, who will provide us with an overview of California's public health response to COVID-19 to date and how CA Notify's digital exposure notification technology has been utilized to support our efforts and ways we plan to further leverage the technology as we move into the next phase of the response. To kick us off, welcome, Dr. Rutherford.
Thank you so much, Holly. It's a pleasure to be here with you all. I'm going to give you a quick tour of the current stage of the epidemic in California. May I have the next slide, please? So the first thing to remember is that we're not a homogeneous society by any stretch of the imagination. We're not homogeneous in the United States, and we're certainly not homogeneous in California. And one of the things that's reflected in are the vaccination rates. Vaccination is highly variable across the United States, and it's highly variable across California. And as a consequence, the incident disease is highly variable across the United States and is highly variable across California. The next one, please. Currently in California, this is a couple of days old, but we're now vaccinating everybody 12 years old and older. And we will this week begin vaccinating 5 to 11-year-olds. We're giving people third doses and booster doses of Pfizer, Moderna, and a second dose of J&J if they decide to. I was at Kaiser Richmond today getting my Moderna booster, so it's actually the system actually works. What is not on this chart is that there have only been about 2.7 million booster doses passed out in California, administered in California. And that's out of a population of 5.7 million people who are 65 years of age and older. And a lot of the modeling that we've done at Berkeley and at San Francisco, which suggests that we're in a race between waning immunity and boosting. So boosting is hugely important. And as I list out the counties here on the bottom right-hand corner, you can see that 8 of the 10 top vaccinated counties are in the immediate Bay Area, and some, Marin, San Francisco, possibly Santa Clara, may well get to over 80% vaccinated as 5 to 11-year-olds get vaccinated. Next, please. California, this is now out of date. This is what happens when you send slides in early. This is badly out of date because cases are increasing in California. We've had an increase of about 20% over the last 2 weeks. And it appears to be sustained, and it tends to be concentrated predominantly in Southern California, in the large Southern California counties. But if you look per capita, it's in the Sierra Foothill counties, the Eastern Slope, Sacramento Valley, and the Central Valley. But the nexus between those two are some large counties like Kern, Tulare, Fresno, and San Joaquin. That's where a lot of the real action is now. The next, please. In California, as I said, you can see here, if you look at where incident disease is, you can see how low the vaccination rates are. Low vaccination rates are coincident or associated with low levels, with higher levels of disease. The other problem is that the effective reproductive rate is increasing. From a low of about 2.1, from a low of about somewhere in the 0.8s up to 0.94. The test positivity was increasing. It's now fallen back down to 2.2. And we're at 6% more hospitalizations this morning than we were 2 weeks ago. The next one, please. So what's this all about? So a lot of this, the recent surge and the current difficulties are all about Delta virus. And Delta virus is a variant. And variants are groups of viruses that share similar characteristics of the same species, if you will, that share similar genetic characteristics. The viruses have the coronavirus has spike proteins on it, which have 1,273 amino acids. That will be on the test. And some number of those, maybe 100, are at the tip of the spike protein, the so-called receptor binding domain. That's where all this action is occurring. And that's where you get these different lineages of viruses based on amino acid substitutions at those sites, which change the three-dimensional configuration and may make the virus, in the case of Delta virus, much more adherent and much more transmissible. The next one, please. So there are a variety of contexts under which variants emerge. One is that there's no immune pressure, which was back in the bad old days. Got states of high transmission, super spreading events, no herd immunity. And there is a real concern, especially in countries with South Africa, like South Africa, with large proportions of their population with uncontrolled HIV infection, that people who have severe immunocompromise will be persistently infected for long periods of time, and they're the ones that may be breeding the next round of variants. So something to be cognizant of. And then there's always this question of species crossovers. We've dealt with this last year with culling mink farms in Denmark and various things. I think everybody remembers about the outbreak and the tigers at the Bronx Zoo. This is a disease that can cross over into certain types of animals, and whether it crosses back, probably not, at least not to any great extent. But it's one of those concerns we have. Could this go off into an animal lineage, develop a lot of different mutations, and come back into human, so it can be transmitted human to human? Theoretical at this point. Next, please. So just to say that the transmission of the Delta variant is intense. It probably has an R sub E, the effective reproductive number, on the order of 6 or 7, which is not that far off from chickenpox, and it's about half of what measles is, which is far and away the most transmissible virus that we have. It's much more transmissible than the earlier SARS strains, maybe 2.5, 3 times more, and more transmissible than the original SARS, than most of the influenza viruses we see. So Delta is not a problem of immune evasion. It's not a problem of the vaccines not working. It's a problem that it's hyper transmissible, and as a result, it'll find everybody who's non-immune. The next one, please. Just to show you how rapidly this is, the Delta has occupied the ecological niche of SARS-CoV-2 viruses in the United States and in region 9. The graph is of the United States, and the dark orange is the Delta variant. You can see the light orange, which is the so-called Alpha variant, or the UK variant, which was responsible for our spring surge last year, has all but been squeezed out. The California variants that we were so interested in, those very light purple ones like B1429 and B1427, gone, erased off the face of the earth. The next one, please. And this is just since July, and you can see it's all Delta all the time. And then finally, my last slide just shows you these data for, show you the data for California. I've tried to make the colors match, but it's not too easy. But again, all Delta all the time. And we have not seen other, worldwide, we are not seeing other strains, other variants displace Delta. So while that might happen theoretically, there's a Delta AY.4.2 variant that's gone up to about 7% of all isolates in the UK. It doesn't seem to be particularly associated with any pathology, any different pathology, or any more increased transmissibility or immune evasion. So that's where we are with variants, and I will turn it back to Holly. Thank you very much for having me.